Hepatitis B is a virus that causes liver disease. Even when signs and symptoms are severe, most people who contract the hepatitis B virus as adults recover completely. Chronic and persistent infections are more common in children and newborns. The liver is found directly below the lower ribs on the right side of the abdomen. Hepatic functions. The liver serves a variety of purposes, including purifying the blood of poisonous compounds, narcotics, alcohol, and other dangerous substances, as well as processing the nutrients ingested by the intestines. The liver creates bile, which is stored in the gallbladder sac, which aids in fat digestion. Cholesterol, blood-clotting materials, and other proteins are produced. The liver is a highly regenerative organ that can repair or replace damaged tissues on its own. Infected cells are permanently replaced by healthy cells, or at least until the harm is corrected. Hepatitis B, for example, is one of several disorders that can cause serious or irreversible damage to the liver. Hepatitis B virus types. Hepatitis B is divided into two types. Acute hepatitis B is characterized by a duration of fewer than 6 months. Hepatitis B chronic lasts at least 6 months. The immune system can generally clear the virus from the body in cases of severe inflammation, and the patient will be entirely cured within a few months. Infections that are most common. In developed countries, the following are the most typical forms of hepatitis B viral transmission. A sexual connection. Using syringes and needles that have previously been used. Having a contaminated needle prick you. Transmission from the mother to the child. Hepatitis B symptoms. The majority of children and newborns infected with the hepatitis B virus, as well as some adults, show no signs or symptoms of the condition. Symptoms and indications usually develop 12 weeks after infection, and they might be minor, moderate, or severe. Some or all of the following indicators may be present as symptoms. Anorexia, vomiting and nausea, weakness and weariness in general, abdominal pain, particularly around the liver, urine is dark, the skin and the whites of the eyes turn yellow, jaundice, joint discomfort. Hepatitis B causes and risk factors. The hepatitis B virus can infect people of any age, color, ethnicity, gender, or sexual orientation. The disease's origins. Hepatitis B virus is spread through contact with the blood or other bodily fluids of a hepatitis B virus-infected individual. Categories in jeopardy. The following groups are the most vulnerable to infection. A group of individuals who inject narcotics intravenously and share the same needle and object with others. People who have unprotected sexual contact with someone who is diseased. People who have multiple partners in a sexual relationship. People who were born in countries where hepatitis B infection is common. People who routinely travel to such places. Hepatitis B virus transmission to their newborns throughout pregnancy. People who have gonorrhea or chlamydiosis, which are sexually transmitted infections. People who are on hemodialysis for chronic renal disease. People who live in the same house as someone infected with the hepatitis B virus. Those who come into contact with human blood as part of their job. People who have had blood donated to them. Hepatitis B complications. The following problems are caused by hepatitis C. Hepatic failure severe enough to necessitate a liver transplant. Hepatocellular carcinoma. Cirrhosis of the liver, a disorder in which the liver develops a permanent scar. Type D hepatitis. Diagnosis of hepatitis B. Pregnant women should get tested as soon as possible to ensure that they are not infected with the virus. Anyone who has unprotected sex with more than one partner, uses combination syringes to inject drugs, or spends a lot of time in areas where the hepatitis B virus is endemic should get tested for liver disease. Examination-based diagnosis. Because many persons with hepatitis B virus have no symptoms or signs, clinicians utilize one or more blood tests to diagnose the virus. These assessments include HBsAg, hepatitis B surface antigen test, anti-HBs test for the hepatitis B virus surface antigen, test for anti-HBc. Additional investigations. The doctor may propose testing to determine the degree of the infection and the health of the liver in persons who have been diagnosed with hepatitis B virus. These assessments include antigen test for E, a test for liver enzymes, alpha-fetoprotein (AFP) test, DNA testing for hepatitis B, liver imaging with ultrasound, CT, computerized tomography, biopsy of the liver. Treatment for hepatitis B. The hepatitis B virus has no cure, but it does have a vaccination that can prevent infection, and persons who have been infected with it should take all necessary steps to avoid spreading the infection to others. Hepatitis C treatment options. There are several options, depending on the severity of the infection and the length of infection exposure. 1. Treating hepatitis C as soon as possible after infection. Obtain a globulin injection,